We don't yet know if the man accused in the Colorado theater shooting has a mental illness, but we do know severe mental illness is likely to surface between the ages of 18 and 25. That's the same age as most higher education students. To talk about what's being done to address mental health concerns at San Diego colleges and in the community is Dr. Sandy Jorgensen-Funk, Director of Counseling and Psychological Services at San Diego State University, and Alfredo Aguirre, Director of San Diego County Mental Health Services. Alfredo, I want to ask you, first of all, what types of mental illnesses tend to surface in this college age range?
Sure. With most of the major mental illnesses like paranoid schizophrenia or bipolar disorder, it is often the case that the onset of the illness occurs actually between the ages of 16 and 25. So you'll begin to see those signs. Another factor is with just the nature of the condition. For example, with paranoid schizophrenia, many of these individuals aren't even aware that they are actually exhibiting the symptoms of the illness.
Okay, so we know the age range, we know there's a risk, but it kind of might pop up. So, Dr. Jorgensen-Funk, what sort of systems do you have in place for mental health, either support or programs at San Diego State?
We have a really wide range of programming available for students to support them while they're on campus. It ranges from individual and couples and group counseling. We have phone consultation that we provide, so anytime a student is wanting to talk with a counselor, they're able to call Monday through Friday and be able to have that initial conversation to get a sense of what's available and what might be a good next step for them.
There's a video, and we're watching this video. It talks about suffering in silence. Is that something you've found that students in the college area really aren't going to speak up if they have a problem?
You know, for some students, they are more apt to call our office or come by our office. Other students are less likely to do so. So we try to reach out to students in a variety of ways, through the video, through other online resources that we have available. We have a Center for Wellbeing where they can drop in without an appointment. We just try to provide as many opportunities as possible for students depending on what they're comfortable with.
And speaking of that, the stigma around mental health, that's just not college students. You have a program that you helped pioneer here in San Diego. It's Up to Us. Tell us about that program and how it relates to trying to erase stigma.
The program is really designed to address the issue of stigma in the community, as well as provide education around suicide and really building more community support and awareness on helping individuals to seek help when they need it. You know, this program really is designed to impact the whole community, of course, family members, people that work in our school systems. To that point, much of our material, our brochures, our posters, are actually being circulated on campuses here in San Diego County, including San Diego State.
So I was going to ask that connection. Dr. Jorgensen-Funk, how does a student at San Diego State or most universities, if they want to get help or somebody thinks they need help, what should they do?
The first thing they can do is just call our office, and the student will call the office and we'll have them talk with one of the therapists and get a sense of what's going on for them. We also really encourage students, staff and faculty to call our office if they're concerned about a student who might be distressed, and we will talk with them about how to help the student get to our office and access our services.
Okay, and we're going to come back to that, but first, how about if you're in the community, you notice a neighbor, a family member, a friend, and you're like, this is just there's something going on here. What should you do?
Well, first of all, it's important to obviously speak to the individual who you're observing and ask them how they're doing and reach out and let them know you care and you're concerned. If you feel like the person is not aware or is not going to seek help, one can always call the Access and Crisis Line and get some information. It's open 24 hours a day, 7 days a week. The number, I believe you're posting it, as well as, or they can go on the website, up2sd.org, and there's a lot of information about mental illness, early signs of suicide. Those are real helpful tips for the community at large.
All right, and in both cases, these are confidential interactions, correct?
Absolutely.
Absolutely. Okay. Yes, that's really important for our students to know that what they come to talk with us about is confidential. It's not information that we would pass on to administrators or to their faculty members.
And also in the community as well.
Yes.
Very safeguards put in place.
Very much
well,
so.
thank you both for joining me and talking about this. I do want to say that we do have have more information about this on our website at kpbs.org. There is certainly links there for counseling and psychological services on campuses at San Diego State, at UCSD, and also in the community. So again, thank you for telling us about it.
Thanks for helping us get the word out. We really appreciate that.
Thanks for having us.